Well, thank you for inviting me to speak to you about the role of cataract surgery in treating angle closure glaucoma as a primary surgical procedure. I had the opportunity to review many of the randomized clinical trials that have been done looking at cataract surgery as the initial treatment in angle closure glaucoma. I think the strongest evidence is in the situation of acute angle closure, where two prospective randomized studies were done in Asia that showed the superiority of initial phacoemulsification over laser peripheral iridotomy. So that is quite striking evidence that showed those patients that had phaco had better intraocular pressures, more open angles, and required fewer medications than the patients that had laser peripheral iridotomy, which is really the standard treatment for acute angle closure. So it's a very revealing study, and I think should guide our future management of these patients. So just remember, if you have a patient that's very difficult to break the initial attack, and you're not able to do the laser peripheral iridotomy, if you can quiet the eye down for a day or two and treat the inflammation, you can go back later and do the cataract surgery as your treatment for the angle closure. I think there's also strong evidence in both chronic, medically uncontrolled angle closure glaucoma with and without cataract, showing that combining the trabeculectomy with a phaco procedure actually results in better pressure control than trabeculectomy alone. And this is sort of the opposite situation in open angle glaucoma, where I find that combining the trabeculectomy with a cataract surgery makes the trabeculectomy less effective. It's actually more effective in angle closure doing a trabeculectomy with a phacoemulsification procedure, and this may be because of the anatomic changes that occur with cataract surgery in terms of physically opening the angle. There's also evidence in the benefit of doing a clear lensectomy in chronic angle closure that is medically uncontrolled. Some of the studies I showed were striking in that trabeculectomy was equally effective as a phacoemulsification in dropping the pressure, over 8 points. And obviously we know that cataract surgery is a very safe and effective procedure that avoids many of the complications associated with trabeculectomy, including shallow anterior chamber, bleb leaks, choroidal detachments, and so forth. So I think it was an interesting discussion in terms of looking at the role of cataract surgery in treating angle closure glaucoma. I think the most interesting results will come from the EAGLE study. EAGLE stands for Effectiveness in Angle Closure Glaucoma of Lens Extraction. And so this is a prospective randomized clinical trial occurring in sites in both Asia and England, where patients with newly diagnosed primary angle closure or primary angle closure glaucoma are randomized to either a clear lensectomy or the standard treatment of laser peripheral iridotomy. So this represents sort of a marked change in the algorithm of treating these patients, and it'll be interesting to see if those clear lensectomy patients do better, not only in terms of pressure control, but in terms of quality of life and cost effectiveness. So that is something we're looking forward to, as those results should be available within the next 6 to 12 months. Thank you.